Welcome. This PowerPoint will be presented by your Student Health Services dietitians, myself, Taylor Greenberg, as well as May Reese, who will be joining us in a few slides. Today, we will be discussing PCOS and nutrition education to guide symptom management. Our main focus today will be targeting nutrition suggestions for managing blood sugar and reducing the prevalence of insulin resistance. Listed here are the objectives of our presentation today. We hope that when you leave here, you are able to understand the factors that impact blood sugar stabilization throughout the day, understand a variety of behaviors that can impact inflammation in the body, and ways to minimize the inflammatory response. Understand the importance of regular eating patterns throughout the day to aid in adequate nourishment and blood sugar regulation, and understanding how to pair carbohydrates, proteins, fats, and fiber to impact satiety and blood sugar regulation. Understand nutrients that can aid in symptom management for PCOS, such as omega-3 intake, phytonutrients, and legumes. And understand the impact of lifestyle factors on the management of PCOS symptoms, such as stress, exercise, and sleep.
What is PCOS? PCOS is a very complex medical condition that involves multiple organ systems. We are still learning about all the different factors that cause PCOS, but know there is often a strong genetic and epigenetic component. Diagnosis is confirmed using the Rotterdam criteria. Uterus owners must present with at least 2 out of 3 of the above criteria to receive a diagnosis of PCOS. Although research is still exploring contributing factors to this complex condition, we know that in many cases, insulin resistance seems to be one of the driving factors. In fact, research suggests that up to 70% of individuals with PCOS present with insulin resistance. Often those with PCOS are recommended weight loss as the first-line treatment approach. However, the presence of insulin resistance and hyperinsulinemia can make it very difficult to lose weight. This is because chronically elevated insulin levels in the body, known as hyperinsulinemia, stimulate increased sugar cravings, promote increased fat storage, especially around the abdominal area, and suppress the burning of fat cells for fuel. Because of this phenomenon, it can be much more effective and sustainable to target insulin resistance itself. This can be achieved through diet and lifestyle interventions, as well as medication or herbal supplements when appropriate. Low-grade inflammation is also often present in individuals with PCOS. Inflammation is a normal part of the body's immune system. However, when inflammation becomes chronic, it can exacerbate processes like insulin resistance as well as contribute to symptoms of PCOS itself. Inflammation can be worsened by weight cycling, crash dieting, and over-exercise, which often occur as a consequence of attempting to lose weight rapidly. In this presentation, we will also focus on ways to mitigate insulin resistance as well as inflammation in the body through dietary and lifestyle interventions. Throughout the presentation, we will be discussing ways to target insulin resistance through dietary and lifestyle interventions. We want to start here with giving you some information about what insulin is and how it works. After a meal, carbohydrate is broken down to glucose, aka sugar, which builds up in the bloodstream. Insulin works to help facilitate the process of glucose absorption into cells by acting as the key to unlock the gateway that brings glucose into the cells and return blood sugar to normal levels again. That glucose can then be used for energy in muscles, liver, and fat cells. In the case of insulin resistance, cells can start to become resistant to the role of insulin, almost as if this hormone becomes warped and doesn't work as effectively. As a result, the pancreas starts pumping out more and more insulin to unlock these cells and bring the glucose in. Over time, this results in elevated levels of insulin in the body, or in the blood, a process known as hyper or high insulinemia, high insulin levels. This can eventually result in chronically elevated blood sugar. Acute inflammation is a normal part of the body's immune system. When the body senses an injury, such as a cut on your arm, it releases inflammatory molecules to target that injury and begin the healing process. When inflammation becomes chronic, for example, when the immune system is being stimulated all the time, it can exacerbate things like insulin resistance as well as contribute to symptoms of PCOS. Chronic stress, poor sleep, poor diet, crash dieting, and weight cycling, as well as overexercise, are some of many factors that may contribute to low-grade inflammation in the body. In later slides, we will discuss dietary and lifestyle interventions that may be helpful in reducing low-grade chronic inflammation in the body. The structure of our daily eating patterns can have an effect on our blood sugar and insulin response. We typically recommend aiming to have breakfast within 1 to 2 hours of waking and a meal or a snack about every 3 to 4 hours following. Pictured above is an example of how different patterns of eating impact blood sugar. The pink line demonstrates blood sugar fluctuations when eating 3 balanced meals and 2 snacks. As you can see, the result is more stable blood sugar with less extreme fluctuations from meal to meal. The purple line demonstrates blood sugar fluctuations when eating only 2 large meals. As you can see, blood sugar rises more dramatically and stays elevated for longer periods of time. This response is due to the larger glucose load to the body at one time. This creates a bottleneck per se, where only so much glucose can be brought into the cells at one time, resulting in more dramatic spikes with higher highs and lower lows. Blood sugar response looks different person to person and may even vary based on your schedule day to day. However, establishing structured eating patterns throughout the day will promote more stable mood and energy fluctuations and help avoid sugar cravings.
We also want to highlight how restrictive eating patterns can lead to binge eating later on in the day. Typically, restriction or dieting behaviors can begin by restricting food groups, skipping meals, ignoring hunger cues, or restricting the types or amounts of food you're eating. This leads to food preoccupation, or thinking about food all day, feeling obsessed with food, having increased cravings, and feeling a scarcity or all or nothing mentality around food. An example of this might feel like I have to eat this all now because I will not have any tomorrow, or instances of eating only healthy or only completely unhealthy, because if you eat something that you would consider unhealthy, then your day is ruined. At some point, the body's biological drive for hunger returns. You may experience binge eating or overeating when this happens. Binge eating or overeating can be described as eating beyond comfortable fullness, feeling out of control around foods, feeling like you need to finish the foods on your plate even when you're feeling completely full, or having kind of like a screw it mentality where you're like, I'm going to eat this whole box of cookies and I don't care because I'm not eating any cookies tomorrow or for the next week or whatever it may be. After binge eating happens or overeating happens, usually guilt, shame, feelings of failure, and negative self-talk take over the brain space and lead us right back to restricting. You can see how the patterns of restricting and binging can turn into a cycle. We are trying to avoid this as the inconsistency of this eating pattern does not support stable blood sugar and can result in a negative relationship with food. This is a handout that can be downloaded below to guide you in meal building. So let's start talking about meal building and what we recommend trying to incorporate at each meal. Each macronutrient is important to incorporate in your meals. This would be carbohydrates, fats, and proteins. They provide the body with different things that help it function. Carbohydrates are usually very demonized, especially when it comes to blood sugar management, but your body still needs carbohydrates. Carbohydrates are the brain's preferred source of energy and used for many other reactions in the body to create an energy source. Because we're talking to a student population here, you're using your brain so often. So we really need to make sure we're giving it enough carbohydrate to feel adequate function. Protein slows the release of glucose into the bloodstream, therefore keeping your blood sugar a little bit lower. Protein also helps us stay fuller for longer and aids in muscle building, hair growth, and hormone production. Fats will also help slow that release of glucose into the bloodstream, helping us keep blood sugar levels a little bit more stable. They help us feel full and satiated after eating. They aid in hormone production, can help decrease inflammation in the body and help with absorption of certain vitamins and minerals. It is important when you're building your meals for blood sugar balance to try and incorporate each macronutrient. We also want to prioritize the incorporation of fruits and vegetables. These will provide the body with phytonutrients, vitamins, and minerals that will help increase the strength of our immune system and decrease inflammation. Certain carbohydrate sources and fruits and vegetables also contain fiber, which is important for slowing that release of glucose into the bloodstream and helping to keep our gut microbiome healthy. This list of foods here is to help you distinguish and get ideas for a variety of carbohydrate sources, fat, and protein sources. Also listed here is different ways that you can consume fruits and vegetables if you have a hard time consuming those throughout your day. There are certain types of carbohydrates or fat sources that may impact blood sugar differently than others. Those have been indicated with either an orange or blue diamond. The foods indicated with an orange diamond may lead to a faster rise in blood sugar and insulin secretion from the pancreas, mainly attributed to their low fiber content. This can contribute to more variable fluctuations in blood sugar levels. Try to pair these sources with a protein or a fat source. The foods indicated with a blue diamond may increase insulin resistance and keep blood sugar levels elevated for longer due to the higher levels of saturated fat in those foods. This doesn't mean that you need to cut out all the foods that have a blue or orange diamond. This is more about eating those foods in smaller quantities or in moderation and or pairing them with other sources of nutrients. We also wanted to provide some examples of putting meals together in a way that is not a perfectly balanced plate like was on the first page, and using those different components we discussed earlier in making those meals, but again, not perfectly proportioned on a plate. All of those components can be mixed into meals that are in bowls or mixed together versus all laid out in perfectly designated sections on your plate, such as tacos, ramen or a rice bowl, oatmeal. You can see how those different components can be included even in a different presentation on your plate.
The graph here illustrates the rate at which different macronutrients are broken down in the body and elevate blood sugar. As you can see, carbohydrates cause the most rapid blood sugar response, followed by protein and then fat. Also of note, the presence of fiber slows down carbohydrate digestion as well. Keep in mind, this graph demonstrates the blood sugar response for when these macronutrients are eaten in isolation. When we make a meal, we're typically eating a combination of all the different macronutrients. This is why it can be important to try and pair carbohydrates with protein, fat, and fiber as often as possible. Listed to the right are some different ways in which we can add fat, protein, and fiber to an existing carbohydrate we may already be eating. For example, if you currently use rice milk, you could switch to soy milk, which will have added protein and be absorbed by the body more slowly. Another example would be adding veggies and egg to your cup of noodle soup. So let's keep talking about fiber. Fiber is a type of carbohydrate that the body can't break down and absorb and instead passes through the digestive tract mostly intact. While most carbohydrates are broken down into sugar molecules that provide energy, fiber can't be and instead passes through the gut undigested. To your right, we've listed a graphic giving you an idea of the average fiber content of different plant-based foods. It is also important to remember that when increasing fiber in your diet, ensure you're also increasing water intake simultaneously. Increased fiber intake without adequate hydration can result in uncomfortable digestive symptoms such as bloating, gas, and constipation. Also note, recommended fiber intake is listed as a range. Individuals with higher energy needs will need more fiber. Individuals with lower energy needs will need less fiber. Listed are additional tips for adding more fiber into your daily routine. It is important to consume fiber from a variety of plant foods, including fruits, non-starchy and root vegetables, whole grains, nuts, seeds, beans, and legumes. When trying to add more fiber into your routine, don't feel like you are limited to only fresh produce. Frozen and canned fruits, veggies, and beans can be a cost-effective and time-efficient way to add in more fiber. In fact, fruits and veggies are often packed and preserved at peak ripeness, meaning they are sometimes more nutrient-dense than their fresh form. Some commonly recommended tips for adding in more fiber include keeping a yummy dip on hand to complement raw veggies, throwing a frozen veggie medley into instant soup, stir fries, or pasta, incorporating more plant-based proteins into meals such as lentils, tofu, or beans, and topping yogurt or oatmeal with nuts, seeds, and fruit. Beans and lentils are a great way to incorporate a plant-based source of protein and fiber into a meal. For reference, 1 cup of cooked lentils contains around 18 grams of protein and 16 grams of fiber. Beans and lentils can be used in many different ways. For example, as a component to a sandwich, in a bean salad, on top of chips for nachos, or in something like a chili or dal. Using canned and pre-packaged forms can be a great way to save time and energy while still getting all of the good nutrients. Here are some examples of ways you can add fiber into dishes you may already be eating. If you're already having eggs and toast in the morning, consider using a seedy whole grain toast and adding fruit or avocado. If you're having pasta, you could switch to a whole grain or lentil-based pasta and add veggies or add a side salad. If you were having white rice with chicken, consider adding stir-fried veggies tossed in a sauce.
Protein is an important part of nutrition for PCOS. Protein helps us feel satiated after meals, leaving us feeling fuller for longer periods of time, and can help curb increased sugar cravings. Protein is also a component that helps us slow down the digestion of carbohydrates, as we talked about in the previous slides, and it will help support stable blood sugar levels. We would recommend aiming for about 4 to 6 ounces or the size of your palm for animal protein sources to incorporate into your meals. When it comes to plant-based sources of protein, you'll need a little bit more in terms of volume to make sure that you're still getting an adequate amount of protein per meal. This might be 1 cup or 2 handfuls of those plant-based protein options. We also wanted to provide you with some suggestions for pre-prepped protein options, as we know these can sometimes take the longest to prepare or can be the trickiest to prepare. And having them pre-prepped can be really great to keep on hand to make meal building easier and more time efficient. Fat sources that contain omega-3 fatty acids are shown to help decrease inflammation in the body. Food sources of omega-3 fatty acids are avocado, fatty fish, grass-fed or omega-3 enriched eggs, seeds, nuts, soy products, Brussels sprouts, and fish or algae oil. Similarly to the last slide, we provided some examples here of ways to include those omega-3s into your diet without feeling overwhelmed. You can purchase salmon or smoked salmon and use that for lox on a bagel or prep the fillets on a one-pan meal. Another option could be to use sardines in addition to eggs and rice, on crackers, on toast, or on top of a salad. We typically recommend that if you follow a plant-based diet or do not eat fatty fish about twice per week, supplementation might be helpful to ensure you are consuming enough omega-3 fatty acids, as the plant-based sources just don't have enough of a high conversion rate into the type of fatty acid that we're looking for that has the evidence to support that decreased inflammatory response.
If you don't find yourself eating these food sources frequently, supplementation may be appropriate. ALA is the type of omega-3 in plant food sources. About 6 to 10% is converted in the body to DHA and EPA. Higher levels of DHA and EPA have been associated with decreased inflammation. Amounts vary based on food. Larger amounts of plant-based foods will need to be eaten to reach recommendations. Eggs vary greatly based on the hen's diet. Phytonutrients are substances found in certain plants which are believed to be beneficial to human health and disease prevention. Different colored plant foods have different types of phytonutrients, vitamins, and minerals. For example, when you eat orange foods such as carrots and butternut squash, you are consuming beta-carotene, also known as vitamin A, a nutrient involved in eye health. When you eat leafy green vegetables such as broccoli or kale, you're eating indoles, which may protect against certain cancer-causing chemicals. When grocery shopping for the week, try your best to purchase a variety of different colored plant foods. Remember that whole grains, spices, garlic, and onion all count. Listed are some examples of ways to incorporate more color into your weekly routine. Consider adding berries, spinach, and ground flaxseed to smoothies. Toss your favorite fruit, nuts, seeds, and leafy greens into grain salads. Create your own antioxidant-rich trail mix with dark chocolate, dried fruit, nuts, and seeds. Or purchase minced canned garlic and toss into stir fries and salad dressings for extra flavor.
Being mindful around the amount of added sugar you consume can be helpful in supporting your blood sugar. Foods that contain high amounts of added sugar will be absorbed in the bloodstream quickly. You can be mindful around added sugars without feeling like you need to completely remove sugar from your diet. For example, when you're choosing yogurt with a little bit of added sugar because unsweetened yogurt just is boring and doesn't taste good to you, that's okay. Having your favorite sweetened yogurt makes your morning a little bit better, and it's not going to ruin your blood sugar. Omitting simple syrup from your coffee because you don't really like it super sweet and it helps you better appreciate the flavor of the coffee beans could be an example of being mindful around added sugar consumption. If you think about this in a way of, if I take this amount of sugar out or this added sugar out of what I'm doing, does it completely ruin the flavor of what I am trying to get through this food or beverage and the satisfaction it provides me? For example, if you're someone who likes to have a soda and you choose a Diet Pepsi or Diet Coke because it tastes the same to you as regular, then that's totally okay. If you're like, I hate the taste of artificial sweeteners and you want to have something like a soda, just pair that with a meal that has protein or fat source to help slow the absorption of that carbohydrate into the bloodstream. Just as we discussed before, if you pair those foods that have added sugar with fat or protein, it will help slow that rate of which the food is digested and the blood sugar is risen. For example, if you like to have a donut in the morning for breakfast, try also whipping up a couple eggs to add protein and fat to your morning. Also recognize that sometimes you might not be able to pair these things together, and that's okay. Just try doing so most of the time. We add an example of a label here to demonstrate how to evaluate the added sugar content in the foods that you are eating. You don't need to check every single label of the foods that you're eating. However, if you are eating a food that likely contains a higher carbohydrate content, it can be helpful to evaluate if that food contains added sugar and or fiber. Some foods have naturally occurring sugar, and some foods have sugar that is added. You can see this from the label here. The total sugar content is going to tell you how much sugar is in the product. If this label were to say this includes 0 grams of added sugar, it just means that whatever you're eating naturally has 25 grams of carbohydrate from sugar in that product. Sugar is just a form of carbohydrate. So on top of this, in the label would say total carbohydrate, and that includes the sugar content as well. As you can see based on this label, the total sugar that would be naturally occurring would be 2 grams, and the added sugar would be 23. So you just want to be mindful around how often you're consuming things that have high amounts of added sugar. Similar to added sugar, we encourage you to be mindful around the amount of alcohol you consume. When consuming alcohol in excess, it can have negative impacts on PCOS symptoms, such as fluctuations in blood sugar, poor sleep, increased inflammation, disruption of hormones, negative impact on mood, and altering the gut microbiome. We have listed the amounts of alcohol consumed that are generally shown to be safe for your reference. Some tips to consider to help mitigate PCOS symptoms when drinking alcohol are choosing drinks that are lower in sugar, such as red wine, dry white wine, or using your own lower sugar mixture. We also recommend avoiding drinking alcohol on an empty stomach, so make sure that you're having a meal before you drink alcohol.
There are many different types of movement that may be helpful for PCOS. Ultimately, we encourage you to explore different options to figure out what you enjoy most, as this will likely be the most sustainable for you. With movement or exercise, consistency over time is one of the most important pieces, which means you have to like it. Here's a little introduction to some different types of exercise. Steady state cardio is a type of exercise where the intensity stays within the same range throughout the duration of your workout. Examples of this would be walking, running, swimming, tennis, etc. HIIT, or high intensity interval training, involves a combination of short bursts of high intensity movement, such as running, burpees, jumping, followed by short periods of rest or moderate activity, such as walking, jogging, etc. 10-minute bouts of HIIT training have been shown to provide cardiovascular benefit and may be ideal for those with limited time to exercise. Also of note, HIIT training can be stressful on the body. It's important to take a look at your life as a whole. If you already are dealing with really high amounts of stress on a day-to-day basis, adding another big stressor to the body, although arguably a good stressor, may not be the most supportive for this phase of life. It's important to speak with your medical provider prior to adding in HIIT training. Last, resistance training is any type of exercise where you lift or pull against resistance. Resistance on muscle fibers is the most effective way to protect and grow lean muscle mass. Although research on PCOS and resistance training is limited, there is an abundance of research suggesting resistance training is a fantastic tool for targeting insulin resistance. Also of note, while exercise is important, there is such a thing as overexercising. It's important to include rest days, fuel your body for movement, and ensure you're getting adequate amounts of sleep to avoid burnout. During periods of acute stress, the body releases stress hormones, cortisol and adrenaline. Cortisol triggers the release of sugar molecules from the liver into the bloodstream to provide fuel to muscle cells to run away from the potential threat. The pancreas then releases the hormone insulin to help bring these sugar molecules back into cells. When stress becomes chronic, blood sugar is consistently elevated, and more insulin is released to combat the elevated blood sugar. It's impossible to make our stressors disappear, but what we can do is start to change our body's physiological response to stress. You may begin to explore different forms of stress management, for example, talk therapy, diaphragmatic breathing, journaling, yoga, spending time outdoors, setting boundaries with others, and building a strong support network. Getting good quality and quantity of sleep is important. Most people need between 7 to 9 hours per night to feel truly rested. Adequate sleep is important for regulation of hunger and stress hormones, exercise recovery, and ensuring adequate energy throughout the day to support other health-promoting behaviors. Sleep disorders are more common in individuals with PCOS than in the general population, so creating a routine with good sleep hygiene is important.
Here are the key takeaways we hope you leave this presentation with. Prioritizing regular eating patterns, aiming to create balanced meals with carbohydrate, protein, fiber, and fat. Explore ways to incorporate more omega-3, legume, and phytonutrient-rich foods. Begin pairing carbohydrates with protein and/or fat sources. Prioritize at least 7 to 9 hours of sleep per night. Practice self-care and stress management. And find ways to engage in movement that you find joyful. There are a few commonly asked questions that we often receive, and so we wanted to take some time to go over the top 4 questions people have when it comes to navigating nutrition for PCOS. The first one is, should I cut out gluten and dairy? The short answer is no. There is no evidence to support that everyone who is diagnosed with PCOS should remove gluten and dairy from their diet. In most cases, the only time gluten should be removed from your diet is if you have a gluten intolerance, a wheat allergy, or celiac disease. Similarly, in most cases, the only time dairy should be removed is when you have lactose intolerance or are diagnosed with a dairy allergy. There is no evidence to support that removing gluten and dairy from your diet will help improve symptoms or result in weight loss. Things to consider are if you eat these foods and you notice a big difference in how you feel. You should always try to listen to your body, and if they don't make you feel good, it could be something to bring up with a dietitian so they can help guide you through that process. The only other situation you may consider a trial with limiting dairy is if you have had pre-existing severe acne to your PCOS diagnosis. In these cases, dairy could be exacerbating those symptoms. Doing a trial elimination with dairy or just limiting dairy in your diet can help you see if your skin would improve once the dairy is removed. The second question we often receive is, do I need to lose weight? Again, the short answer is no. If you feel that weight loss is something that's important to you, you have full body autonomy and the power to make that choice. However, it is not recommended to all people with PCOS. Weight gain from PCOS can be caused by a variety of factors and symptoms that can improve when weight is reduced, but not always. High levels of androgens can occur from the start of puberty, especially in people who have irregular periods from the start of menarche. Higher level of androgens can cause higher levels of abdominal adiposity, which is abdominal fat. When androgens are elevated in people starting from puberty, it can cause a lot of inflammation and increases the risk for developing insulin resistance. Insulin resistance itself can increase androgen production and increase body weight. Insulin resistance can also occur in all body weights. Symptom driving factors can be genetic makeup, lifestyle, body weight, and development of high androgens. So if we try to solve weight simply with diet and exercise, it may not be very effective, especially when using extreme measures of dieting and exercise. In some cases, those extreme measures can only make symptoms worse, result in weight gain, increase cravings for carbohydrates, and lead to the development of disordered eating or an eating disorder. Those with PCOS are at an increased risk of developing an eating disorder. There are many factors to consider when deciding to focus on weight loss during your journey of PCOS. Focusing on symptom management, hormone balance, and stabilizing blood sugar may have a higher rate of positive effects than simply focusing on weight loss alone. There is also evidence to support that increasing exercise, still to a reasonable amount, has positive effects on mitigating PCOS symptoms, regardless of if weight changes happen from that exercise.
Third question, can I eat added sugar and refined carbohydrates? Yes. In fact, labeling specific foods as off limits or bad can cause us to feel guilt or shame when we do eat these foods. Avoidance can also result in a sense of deprivation, causing us to obsess or fixate over these off-limits foods. For some, restricting ourselves inevitably leads us to feeling out of control and binging or overeating when these foods are present. This is a phenomenon known as the binge restrict cycle. When we try to make up for the damage by dieting or restricting, this inevitably perpetuates the cycle. Allowing yourself to enjoy these foods in moderation is often the most effective way to prevent these feelings of deprivation. I do also want to acknowledge that, yes, it is true that refined carbohydrates are broken down and absorbed more quickly in the body, causing more of a rapid blood sugar spike. However, it is important to remember that your hemoglobin A1C is your average blood sugar over a 3-month span of time, meaning it looks at the average and is not going to be ruined by a single dessert or sweetened coffee drink with simple syrup. It's important to look at the bigger picture and start to get curious about your choices over time. We can also modify the blood sugar response by pairing refined carbohydrates or foods with added sugar with protein or fat to slow down rate of digestion. For example, instead of eating a croissant by itself, order your favorite croissant sandwich with egg and cheese for added protein and fat. Additionally, it can be helpful to look at areas of your diet where added sugar, refined carbohydrates truly bring you joy and enhance the flavor of your food. Prioritize and really enjoy these foods while cutting back on sources of refined carbohydrate or added sugar that feel less important to you. Last question, should I be intermittent fasting? It depends. We won't get too into the weeds, but certain types of intermittent fasting, for example, when someone goes an entire day without eating or has a prolonged fasting window of 14 plus hours, is not typically recommended for patients with PCOS, given the increased risk for undernutrition, which may negatively impact hormones, binge eating, often related to food deprivation, and wild fluctuations in blood sugar, energy, and mood. Some benefits have been found in terms of digestion and insulin secretion when looking at a specific type of intermittent fasting called time-restricted feeding. Time-restricted feeding means eating within a specific window of time. For example, from 8 a.m. to 8 p.m., often known as a 12-12. This pattern of eating better aligns with your body's natural circadian rhythm, or your sleep-wake cycle. It is important to note that this is not something you need to engage in or do every single day for improved digestion or insulin secretion, but just another tool in your toolkit if it might seem helpful to you. It's also important to note intermittent fasting may be contraindicated in certain populations of people, including those with eating disorders or disordered eating, women who are pregnant or breastfeeding, underweight individuals, those who need to take medication with food at specific times, or those taking medication for blood sugar management. It is important to discuss this with your healthcare provider if you have any questions.
Here are our references for all of the pictures that we used during this presentation. Here are the references to the research articles used to provide information given during this presentation.